Most of the patients are having asthma, COPD, interstitial lung diseases, and also to know the basic physiology of the respiratory system is very much important in order to operate a good ventilator, in order to operate the workstations, in order to anesthetize the patient. To understand the basic physiology of respiratory system is very much essential for the anesthetist. On this background, we are going to start the respiratory anesthesia. Coming to the anatomy of the respiratory system. Sometimes the questions ask about the function of the nose. Okay. Sometimes it also asks about the questions of the arterial supply of the nose. So this type of question also the NBA is going on asking or putting on this type of question in the theory exams. So therefore, in this literature, we are going to give thorough about the what are the questions already been asked in the 5 years or 7 years back. Againly, what are the possible questions that can be asked in the coming years. On the basis of that background, we have given a complete notes on the respiratory system. Coming to the anatomy of the respiratory system, mostly the respiratory system is divided into two parts, upper respiratory tract and lower respiratory tract. The upper respiratory tract is just all the organs which lies outside of the thorax are known as upper respiratory system, and the organ within the thorax are known as lower respiratory system. Upper are nose, pharynx and larynx, and the lower respiratory tract mostly consists of trachea, bronchi, bronchioles, alveolar ducts and alveoli. So these are the systems which are below the thorax and they are known as lower respiratory tract. Organ outside the thorax are known as upper respiratory tract. They mostly consist of nose, pharynx and larynx. Okay. Coming to the nose. The nose. What are the parts of the nose? It is a cartilage. The upper cartilage provides support to the sides of the nose. The lower cartilage adds with the width and height of the nose. It provides shape to the nostrils and also the nose tip. It simply is the outer covering. There are two types of cartilage, upper cartilage and lower cartilage. Nasal cavity. It is a hollow space through which the air flows in nose. Nasal cavity, it is also known as nares, through which the air flows in and air goes out. Septum. The septum divides inside of the nose into two chambers. It is a thin wall made up of bones and cartilage. The septum is made up of both bones and cartilage. The inner part is made up of the cartilage and the outer side is made of the bones. It supports the breeze of the nose. Bone supports the breeze of the nose. It is lined by the mucous membrane. The mucous membrane lies inside the nose, sinus and throat. It helps in warming the mucosal. It helps in the warming of the nose. It helps in moisture of the nose. It also warms the air which we breathe in. So therefore, it helps in the humidification of the air. Suppose we are breathing in the cold air, then the nasal mucosa convert the cold air into warm air, and finally we are able to breathe the warm air. So it helps in both moistness and also it humidifies the air which are taking it. It also forms a sticky mucus that prevents the dust and other small particles from the entering to the nose. Turbinates. Each side of the nose contains curved turbinates and the bony ridges are lined with mucous membrane. Sinus. The bone around the nose contains hollow air-filled chambers known as sinus. The mucus flows in the nasal cavity through the sinus only. So turbinates and sinus are also there. Along with that, the most important structure in the nose is the mucous membrane. The mucous membrane which are lying in the nose and nasal cavity, they help in the humidification of the nose and also they provide the humidification of air, whatever we are taking in. Second thing, they also help in the removal of the different dust particles from and they prevent the dust particle from entry from the nose to the lower respiratory tract. Coming to the function of nose. It helps in inhalation. It helps in inhalation. It helps in the purification of inhaled air. We have already discussed the nasal mucosal helps in the purification of inhaled airs. It is an organ of smell. And it is a smell of taste. Okay, whatever we are taking the food, the tongue allows us or the tongue helps in to taste the food, and simultaneously the nose helps to smell it.